we had a shelter at First Christian Church in San Jose, where we had people living. And when we became involved with the homeless, all of a sudden we started to notice that one of the big causes of homelessness is medical bankruptcy.
Liz used to be covered at Kaiser under her husband's plan, where he used to work in a machine shop. However, he was laid off in 2004, and since then, she has been forced to rely on the Valley Medical Center Ability to Pay plan. Associate Pastor Adrian Lawton is a cancer survivor whose illness was diagnosed late and treated less effectively because she was uninsured and had to make do with the Ability to Pay program at the Valley Medical Center. Mary works part-time in a dentist's office, so she sees the crisis from both sides. Because she is part-time, she has no health insurance herself. In addition, she spends a large part of her job trying to track down payments from dental insurance companies. Mary, you have a unique perspective on this debate.
Yes, I do.
Tell us about your experience.
Well, I do. I see it from both sides of the coin. I mean, because I am temporary, and I'm part-time, I don't qualify for insurance. And actually, for the last 7 years, I've worked as a temp. That's where that came up. And a lot of temp agencies don't give you health care. And if they do, it's very, very limited. But then during the day, I have to track down. I work in a dentist office. I don't get dental insurance.
Does your boss not see the irony in that?
No. No,
now,
I don't
is there
think
any wiggle room? You know, kind
yes,
of
yeah,
there is
some. There's some wiggle room. They'll, let me make payments and probably give me a discount. But
But otherwise, it's
I
still
would
really
think
painful.
because I mean, it's like a walking billboard advertisement that he would do that. But
How many temp people work there?
there's like 5 of us that work there. Yes. But on the same token, I do understand this because I do process insurance claims. Part of the office is a dental office, the other part is an orthodontist. So we have to get on the phone and we have to find out what the maximums, what the deductibles are, and it's amazing what they don't pay, and it's amazing what the little minute things are. It's like a timeline. If you don't submit a claim in a certain amount of time, it gets lost. They won't pay it. They won't pay it. They go, well, you had the window of opportunity was lost, so they won't pay it.
I mean, at this point, you're kind of like a debt collector, right?
Yeah, exactly. And there's a couple of them that are notorious that say, well, go ahead and fax your claims in. And our fax machine gives us a printout saying, yeah, it was cleared, confirmation. Oh, we never received it, resubmit it. So they buy time. They're just buying time so they don't, get as much interest or whatever it is they're doing, but they do buy time.
Right, you said even just the change of the person's first name will be enough for them to delay their claim.
We know our patients as Randy, Emily, Sandy or Candy,
Sandy
whatever it is,
Sandra
instead of Candace, yes. And in this particular case, I got one back that said, no, his name is Randolph. But, you actually, it's almost like you're applying for a government job when you go to get insurance. You have to have your social security number, you have to have this, last address, the address where you lived prior to that for the last 5 years, So, I mean, the nickname shouldn't be a criteria for that, but it's a delay tactic is what it is. Mm-hmm. Exactly.
I don't think a lot of people realize how insurance companies actually dodge payments, because in our everyday lives we couldn't be that successful at dodging payments.
Of course not. And I do believe most people will probably put the blame on the dentist when it's actually the insurance company, trying to get their money from them. Yeah.
Now, we all know that, well, we all should know by now that insurance companies make tremendous profits.
Yes, they do.
And so, and you're basically saying this is how they do it. They
Yes.
kind of take it out. So what is a common action? Are they just expecting you to bill the client and then hoping that they don't have to recoup that in-between amount? And so
Right.
the client will take over and then the insurance company is off the hook. Is that, how often does that happen?
That happens quite a bit. There are certain insurance companies, and there are a myriad of different plans that the public person that is getting the member, as they call it, is trying to apply for. And they, some of them will say, well, actually, you pay it and then submit the claims to us, and we'll turn around and pay. That's the one they would like because they can, they can take their time with
never
it.
see their money.
Exactly.
Mm-hmm.
And then there's others that, no, go ahead and bill us directly, but, we'll pay 50% of what the actual bill is, Preventative dentistry should be 100%, but it's not. It's only sometimes after the deductible. You got the deductibles. You've got time limits for deductible for dependent children. They'll only pay till they're 18 years old, and then boom, they're on their own. It's a little dance that they like to do.
Absolutely.
Yeah.
I think that it puts it in perspective for people who
Yes.
have insurance to relate to other people who don't have insurance, to really understand that it's not so much about being underinsured, which that is a huge
right.
issue,
It
but at the
is,
same
yeah.
time, you have professional payment dodgers.
Yes,
It seems
exactly.
to be the case.
And if
because
they're
I
not
know-
doing that, they're dictating as to what they'll pay. They're dictating the treatment that they pay, the patient can get. So
So you attended the National Conference
I
of
did,
Healthcare
yes,
Now. What
I
was
did.
that experience like?
it was a wonderful experience for me because I got a wealth of information in terms of the insurance reform that they're trying to do.
What's that?
Well, there was a public mandate, which is what is passed right now. In other words, the insurer, everybody has to have insurance. Otherwise, it's going to be like you have to have car insurance. But it was public option. What Healthcare Now was pushing was single payer.
And what's
And
single payer?
Single payer is everybody in, nobody out. Single payer is healthcare is a human right. And it is a human right. And one of the things, I got to go representing Cham Deliverance Ministry, and I got to, most of the conference was built around what we can do in terms of legislation, the in and out workings of the political world of it, but it has a human face. There's people that suffer because they don't get the medication that they need. There are people that came to this country, but they're not legal immigrants that are being denied. I know of a particular situation in Georgia where a gentleman is going to be denied dialysis because he is not a citizen of the United States because Georgia passed a law.
Oh.
And he said, I'm afraid I'm going to die. So, I just hope he gets to maybe like Canada where, at least they get the medication that they need and they get the treatment that they need. And they're not waiting around for 6 years in a waiting room.
Absolutely. We're all in this together.
Right.
So what did you take away from that conference as far as what, everyone can do?
Well, what
as an individual?
Actually, I had the most revealing thing was on the plane ride going back. I was talking to a retired postal worker. And she was saying that, she had to have knee surgery. And she said, the bills are still coming in, but she said, I worked hard. And if people want insurance, then they just need to get a job. And I said, you realize that unemployment is in double digits right now. And she said, well, blame that on the president. And what it needs is you need to make the public aware of this. There are so many people that are becoming homeless right now because of medical bankruptcies.
It's
homelessness,
the leading cause of bankruptcy.
homelessness and the healthcare crisis are interrelated.
Mm-hmm. And that affects us all.
It does. It does
always
affect
comes
us
back
all.
to
Yeah,
of
it
us,
does.
doesn't it?
It absolutely does.
Thank you so much for sharing
welcome.
your story.
Thank you.
And you offer such a unique perspective, and I hope that you get dental insurance soon.
I hope I do too.
Thanks so much.
Thank you.
Liz Gonzalez is a member of Voluntarios de la Comunidad. She is knowledgeable about the impact on immigrants of the recently passed national health care reform, the immigrants who are left out, and the possibilities for immigrants with single-payer health care. I am so excited to hear about this. Immigration, healthcare reform are two things that are definitely impact Americans. So what's your experience?
Well, just recently with the health bill and immigration, I think they were pitted against each other, you know.
As far as priority?
Priority, or immigration was totally ignored because of healthcare, because we wanted to pass this big bill that was going to change the way, we do healthcare in the United States. And now that it passed, people are claiming it as a victory, but they don't see that it really has left us, we shouldn't be claiming victory over this bill, because
why not?
It still leaves about half of the American population uninsured or underinsured. It's giving the majority of the money to, middlemen, corporations, and still like bureaucratic processes instead of delivering adequate health care to people.
Now, walk us through health care through the immigrant in California.
Well, with the new bill that will be in place shortly, legal immigrants who are documented are going to be treated the same as U.S. citizens. They're going to qualify for this new health care. They have to verify that they're legally here in the United States. But the kind of care that it's going to be provided is kind of, below par, subpar. It's still kind of a system of, if you have enough money to pay, you get better care. Versus if you have no money to pay, you get low quality health care. And undocumented immigrants, unfortunately, are still in the same boat. They don't qualify for any of these services. Currently, they don't qualify for any services except emergency care. So there really was no change for them. Children of undocumented immigrants are still eligible for health care as they are right now, and pregnant women also. But sometimes they have to wait 5 years for this kind of services. Yeah, to prove that they're, here legally in the country. Federally,
so after 5 years, they're
after
eligible.
5 years,
saying, what's
eligible.
a pregnant woman going to do for
health care?
Right.
It leaves a lot of people without insurance still. When the story seems to be that, now everybody is going to be insured, but there's a lot of people that will not have access still.
And I have a feeling this still affects us all, even, undocumented, documented. We all Americans pay the
all
price
Americans,
for this.
Definitely.
So how are undocumented workers taking care of their health?
Well, I think it's a lot of self-care, self-care, and using the few resources that are out there, maybe like community clinics, even pharmacies that have doctors there where you can, just walk in with something that is not so critical. But as a last resort, people do use the emergency room. But that is if you're really seriously sick or injured.
And we all know what happens when you put off a problem. When you notice when it's small, it just gets bigger and bigger and bigger.
And we really need to be preventing things, because a lot of things can be prevented, but there isn't that primary care and that regular care.
So what's your work dedicated to? We'll describe what you're doing right now.
Well, I'm part of a group I'm part of a lot of groups, but Voluntarios de la Comunidad is working around mobilizing for immigration reform, and that includes that healthcare is a human right. So that we should all have access to
And what
healthcare.
Specifically would you like to see?
I would like to see this new bill, go a step further and make it, go a lot of steps further and make it single-payer healthcare where everyone truly does have access to healthcare.
I totally agree with you. And is there somewhere that you meet, or somewhere that someone who's involved with specifically immigration in relation to healthcare, can they contribute or get involved somehow?
To get involved with Voluntarios, you can see the website, voluntariosdelacomunidad.org also.
Okay, thank you so much for coming in, Liz, and telling us your story. I think that it's an issue that doesn't get enough attention as far as immigration. I know that me personally, being uninsured, I have relied on WebMD and some other kind of homemade remedies to avoid going to the doctor. But it's, it's not something that, a few million of us in California can do. We need actual health care for everyone. So thank you so much for talking to us. Sandy is currently insured through his wife thanks to the government COBRA subsidy enacted in last year's stimulus plan. However, it only lasts a maximum of 18 months. Sandy is knowledgeable about the shortcomings of the current bill and the benefits of single-payer health care. Tell us about this bill, Sandy.
Okay. Let me give a little background first, which is that I'm part of a ministry, and we've been involved with the homeless for about 20 years. And in fact, we had a shelter at First Christian Church in San Jose, where we had people living. And when we became involved with the homeless, all of a sudden we started to notice that one of the big causes of homelessness is medical bankruptcy. And then we also started to notice that a lot of people couldn't get out of being homeless because they'd go try to find a job, and in order to find a job, they'd have to give up their Medi-Cal coverage for their family. And so it was like a disincentive because a lot of especially the entry-level jobs don't offer insurance. So we began to investigate this healthcare system, and we became big supporters of a single-payer healthcare system. And right now there's a bill in California, it's called Senate Bill 810, which would set one up in California, which we're working in support of. And the other thing that we found out is that around single payer, the thing that really appealed to us, because we're a Christian ministry and we have kind of a human rights perspective, this treats healthcare as a human right, which everybody deserves, instead of something that's like a commodity to be traded in the market. There was a former insurance executive who was on a lot of talk shows last year, and he said that our current health system is like an ATM machine for Wall Street. They just go in, invest in these insurance companies, and take out huge amounts of money for their profits. And the result is we're getting less and less care. What a single-payer bill would do is it has a lot of good features, and Senate Bill 810 is one of those bills. One is universal. It covers every single person from birth to death. I have right now, because of my wife's job, I have an insurance card which I carry around with me, but people would get this card. People would get a card like this the day they're born. And it doesn't matter what your citizenship is, what your job is, what your employment, immigration status, any of that. That doesn't matter. If you're human and you're living in the United States, you would get a card like this, and you could go to any doctor or any hospital and get covered. And that's what was so attractive about the system. And the thing that's interesting about it is that a system like that costs about half of what we currently pay in America for healthcare.
How is that possible?
Well, it saves it because it eliminates all the overhead of all these insurance companies, which take a profit out of the system, as I was saying, and all the investors, which invest in it and need to take a profit out. And it also eliminates all of that paperwork, which Mary was talking about chasing, every little dentist's office or medical office has to go chasing after 20, 30, 40, 50 insurance companies to get paid. And it eliminates all of that. It's very efficient. And in fact, the proof of it is that we already have a system like that in America for people that are 65 or over. It's called Medicare. And so another name for single payer health care is called Medicare for All, because it's interesting in the recent healthcare debate. One of the big debating point is some of the people that were opposed to healthcare reform, they said, don't do it because it'll hurt our Medicare. So Medicare is a very popular system in America among older people. It works well. The overhead is about 2 or 3%. And so everybody supports it. And there's no reason why that couldn't be extended to everybody. And that's why we supported it. It would be equal. It would have a single standard of care for everybody. It would have fair financing so that the people who have the least would pay the least, and the people who have more would pay more. It would have single payer financing, so the insurance companies, the for-profit insurance companies, would be eliminated out of the healthcare industry. It would have retraining and reemployment for the people that work for those companies so that they wouldn't just be eliminated from the economy. And it would also be completely comprehensive and cover all healthcare, because there's a lot of plans now. You get a little bit of this, a little bit of that, and you don't get full coverage. But really, if it's a human right, everybody deserves it, and you deserve it for every part of your body. You don't just deserve it for everything except for your teeth. Right now in California, people who are on Medi-Cal can no longer get dental visits. They no longer have dental coverage. That's been eliminated because of the budget crisis in California.
Good way to your health.
Absolutely, and your teeth, they're right near your brain. It's a very sensitive area, not to mention painful. It would cover doctor's visits, nursing care, nursing homes and long-term care, hospitalization, preventive and rehabilitation services, access to specialists, prescription drugs, mental health treatment, dental, vision, occupational health services, medical supplies and equipment, basically every aspect of healthcare. And it's actually done in many countries around the world, and very economically. Canada is the one that's closest to home, and they pay about half of what we pay per capita for healthcare, and they get it for everybody. So we can do the same thing here.
That sounds fantastic. So how does someone get involved democratically?
Well, our ministry is part of a coalition. It's called the Single Payer Coalition in San Jose. There are other national organizations. Mary mentioned Healthcare Now, which is at healthcarenow.org, and that will give you information on single-payer efforts all around the country. Right now, because this bill has passed, and a lot of people are left out of this bill, and healthcare advocates had mixed feelings about this bill, because there's some good extensions of coverage. There's an extension of Medicaid, even though we have to wait about 4 years for it to happen. But that's all good. The negative side is that now there's this thing called the individual mandate, where people are forced to buy insurance. And one of the big bad side effects of that is it's going to enrich insurance companies, which already kind of control our government, between them and the banks. And to enrich them more is going to just further consolidate their political control and make it tougher for us to get a better bill through. But at any rate, we're continuing to go forward. We're fighting for this bill in California. It's called Senate Bill 810. It was actually already passed by the state Senate. It's going to the Assembly soon. Unfortunately, it'll probably be vetoed by this governor, but as we all know, this governor is through after this year.
And thank you so much for really thoroughly describing what are the improvements we need to make on our healthcare legislation, because we have a long way to go, but
Right.
we need more people to get involved. And thank you so much for
and
the details.
The thing that's really good about this healthcare bill that passed, it's better than the actual bill, is the movement that was created around it.
Absolutely.
More people got involved, people got mad, even people that were against it. If they're involved, there's hope, because when you're involved, you're paying attention, you're studying things, and you're forming opinions and getting educated, and we're going to get a better world from it.
You're not part of the solution, you're part of the problem, right?
Amen.
Okay,
Amen.
Thank you so much for coming.
Thank you.
Sandy.
Thank you.
Do you ever wonder what your healthcare premiums do pay for? Well, a big chunk of your money goes to marketing, advertising, lobbyists, outrageous salaries. Oh, yeah, profits. Imagine if all the money you pay every month just went to healthcare. Maybe then all of your healthcare needs would be covered all the time. We need California One Care. More for you, less for them.
California One Care. Full care for all for less.
Single payer, there's one single payer who gives a damn. Single payer, and that is our old Uncle Sam. Our vets who return from the battle get treated at any VA, and even Dick Cheney must prattle. They served and the nation must pay. Those folks who are gravely disabled and can't hold a job anymore can go to the doctor for treatment, and Sammy will settle the score. But millions get injured or sickened. They're sunk by their medical costs. Insurance is right in the middle to rip off the sick and the lost. In Italy, Germany, and Sweden, in Canada, England, and France, they're not worried sick about health care. Their taxes have paid